welcome to episode 3 of season 2 of Digital Mental Health Musings. We're really excited to have Dr. Tania McMahon joining us in the podcast today. Tania is a very valued member of our team. She's a senior research officer within the eMHPrac team. She's also a registered clinical psychologist. So she's been part of the psychology research team for well over a decade now. So she's been working, helping develop and test a range of innovative therapies and technologies in the online space, primarily around helping improve mental health and wellbeing. So she's really well placed to have this conversation today. Outside of the team, it's probably really critical to mention that she works in a private setting. She's got private practice where she is an enthusiastic advocate of mental health services and resources to complement the treatment she provides to the adolescents and adults that she works with. So welcome, Tania. Thank you for joining us.
Thanks for having me, Ruth.
Alrighty, so the topic of today's session, for people who don't know, is on burnout within health practitioners. So we know that it's been a really tough few years. A lot of health practitioners have been struggling and are struggling. And we also know from recent data that came out last year that during the first year of the COVID pandemic here in Australia, of a survey of, I think it was around 8,000 Australian health professionals, almost 60% reported significant levels of burnout. 70% reported moderate or high levels of emotional exhaustion. And a similar figure, nearly 70%, recorded a significant decrease in their sense of personal accomplishment, which we know is a common presentation with burnout. So, that data really highlights the challenges that we're facing as health practitioners in the community, in private practice, in hospitals, wherever. So I guess it's really important we have a chat today, Tania, about your experience in this space. And what practitioners can do to help themselves and help the people they work with. So I guess to start with, tell us a little bit about kind of you, what is it that you like about this space?
Yeah, it's I've been really lucky to be able to work, feet in both worlds of research and practice. So really love how innovative digital mental health is, how much it's really taken technology and used it to improve mental health care in so many different ways. And I love being able to immediately take that and apply it in practice, and kind of experiment with the different ways that it can be applied in practice as well, because it really isn't a, cut and dry, this program is for this and that app is for that and that's it. There's so many ways that digital mental health tools can be integrated into practice, integrated into our own self-care, and so forth. And, it's been a really, I found it to be a particularly important tool to kind of draw on and rely on through the pandemic, in the face of such incredible, unprecedented demand, which I know everyone's probably very familiar with.
Yeah. I just want to pick up on adding to that as well, because the last conversation we had was with David Backer from Mood Mission. And he also made that point that you just did about, the applicability of digital mental health tools. And, it's not necessarily just for one presentation. You can really pull it in for different elements of whatever people are presenting with. So in line with that, I guess what is it that you think are some of the unique challenges that health practitioners are facing in relation to burnout?
Well, I think that the nature of our work is such that all of us are really personally invested in what we do. We have a lot of compassion. We have a lot of empathy. It's, really what drew probably a lot of us to the field. But that's not an infinite well for most of us, as much as we'd like it to be, or we act like it is.
Yeah.
And I think with the demands of the pandemic and lots of people needing lots of help, ourselves needing lots of help, because this has been a real worldwide trauma. This is not just something affecting our clients or our patients. This is affecting us too. It's really, really pushed that empathy and compassion and that personal investment to its limits. So I think perhaps that's what makes us all at more risk of burnout than other professions might be.
Yeah.
Definitely.
And I guess, what's your experience? Because, you've been working in private practice over the last couple of years. How has that sort of played out for you on a personal private practice level? What have you been experiencing?
Oh, well, it's really tested boundaries, because I remember back in what was it, March? It was March 2020, going back a few years now. That's how long the pandemic has been. And the lockdowns kind of started, those initial lockdowns, and I remember all of us at the practice that I work at bracing for this tsunami. There's going to be so many people needing help, and we were ready, we were waiting, and then it was like tumbleweeds, it was crickets for a few months.
Yeah.
For a few months, there was nothing, and then about 4 to 6 months in, I think it was around that August, September mark, we just got slammed, just referral after referral. And we, not having encountered this before, just kind of stuck with our normal processes. Okay, there's some new clients, book them in. Oh, you've got a space, but we'll book them in. Yeah. And very, quickly, because, we wanted to, help all these people. There were also lots of, I guess, previous clients who hadn't been or hadn't needed treatment, or therapy for a while, coming back because mental health issues had been re-triggered, had been brought back up. Yeah. So all of a sudden we're going, okay, yeah, we'll fit them in. Then all of a sudden we're noticing that that everyone's books are full and everyone's trying to squeeze in appointments, and that's what I was doing as well, squeezing in appointments after hours on extra days. I opened up extra days to be able to fit more appointments in, and all of a sudden our boundaries were getting really heavily stress tested about, well, where do you draw the line? You've added 2 extra appointments, could you add in a third? So that's really how it was playing out in private practice. Was very rapidly we were kind of stress tested to the point of almost breaking point, where you then have to start up a wait list, and then you have to start making calls about who are you going, who's an active client. Is it someone that you've seen within the last 2 months, 3 months, 6 months? That kind of thing. And that
you're quite a large practice, Tania, aren't you? Sorry to interrupt.
Oh, yes. Yeah, large practice, lots of psychs there. And so that kind of testing of your boundaries, where you're having to make these calls, is so emotionally draining, because in a normal circumstance you can absolutely see that client who you saw 2 years ago who's come back. Of course, come sit down, how have things been? Yeah. Today I'm having to go, I'm sorry, you're a new client. I'm going to have to send you elsewhere. Where else can I send you? Everywhere else has their books closed. And someone that I know personally, this client that I know personally, from our previous relationship, I'm having to kind of leave in the lurch. It's a horrible feeling, and that really sapped my own kind of mental and emotional energy a great deal.
Yeah.
So I really think that makes us at much higher risk of burnout. And in addition, just I guess on that note, just then the general workforce shortages and resource shortages that I guess we've faced historically. Most psychologists would agree, and health workers would agree that the whole sector is massively under resourced. We don't have anywhere near as many psychs and allied health and other health workers that we really need.
Yeah.
And so when you don't have that ability to go, oh, sorry, I can't take you on, but here's a practice that's got appointments ready and waiting, when everyone's there's shortages right across the sector, you're far more likely to then burn out yourself, and then that kind of snowballs the issue.
Yeah, which brings us right back to that data that I mentioned at the start of our conversation, the 60-70%, which is through the roof.
Yeah.
So what are we talking about here? And obviously this is in the context of psychologists and your own private practice. Yeah. But, we know that it's across the board in terms of health practitioners. It's not just psychologists.
Absolutely, yeah.
What were the strategies that you used to kind of help with that overload? Because clearly you had to pivot to telehealth, as lots of people did, which in itself was a significant challenge. What strategies, or how did you utilize the digital resources to try and help cope with that draining of your own resources, but also to continue to meet the need of the community?
I think that at the time I didn't realize, I don't think I realized how quickly I was experiencing burnout at the time. It was just kind of, you feel like you're just in survival mode, and later you go, oh wow, I was really burnt out then.
Yeah, absolutely.
So I don't think that I consciously at the time went, okay, I'm really burnt out right now, I'm going to go and use some, I'm going to, go and use these digital resources to make sure that I keep on task. But what
just doesn't happen, does it, with anybody?
This doesn't happen. Well, I'm feeling rather burnt out. I'm going to go use this app and make sure that my self-care isn't neglected. So it wasn't as much of a conscious process at the time. But interestingly, I did end up almost kind of being nudged into using digital resources that I was already aware of and did use to an extent in my practice. Yeah. I was kind of just nudged into relying on them a lot more heavily to make my job easier. Yeah. And that then indirectly helped me manage the burnout, because for me, it wasn't an option. I had to keep going. I actually was pregnant at the time, and so I knew I was going to be finishing up at some point. So I knew that sort of, and I didn't really want to, I wasn't at my breaking point either. I wasn't like, I have to stop for my own well-being. I was like, whoa, I'm just really stressed and this is full on, but let's just figure out a way to make it work and keep going. Yeah. But yeah, I ended up relying far more heavily on digital resources than I typically would have when I had more energy and headspace and things like that. So for example, I had a few clients who I couldn't see for it was almost a couple of months because of just being so booked up. But I, agreed to see them and they wanted to see me. So knowing that there was going to be a couple of months gap, I lent on some of the online treatments. So, things like MindSpot, This Way Up, that deliver a full treatment package. Yeah. So basically gave those clients a head start to treatment. So, go on, do this program. I picked This Way Up for quite a few of them because I really loved how I could prescribe them the program, log in and see, which lessons they'd completed, see their outcome measures and things like that. So they got a bit of a head start. So by the time I saw them, they'd covered a few skills, which was really helpful. And I also used that for a couple of clients where, again, our treatment frequency couldn't be as much because I was so fully booked. So instead of, I only get to see this client once a month and we're spending the whole session going through unhelpful thinking patterns, they were doing that between sessions, and I was able to actually focus on engagement and rapport, maybe talking through some more sensitive issues with them, really utilizing my skills, to I guess, meet them with what they really, really needed in the sessions, instead of filling it with kind of lessons about, the material we had to cover, which was also necessary, but it was something that they could do between sessions. So that was really helpful. And then, they'd come back and we'd talk about how they applied those skills and how they were going with that. It worked beautifully.
It really enhances your efficiency in terms of what you're able.
Yeah, it really did. So I lent on that. I also found myself leaning even more on crisis support service, counselling services for between sessions, Lifeline, suicide callback service, eHeadspace for general counselling for younger clients, 1-800-RESPECT. And of course, I would refer to these normally in sessions, but I found that more clients were getting more distressed more often between sessions than normal. And instead of, they'd be, emailing reception and, trying to get appointments with me, I'd lean more on those services between sessions. So it meant I'd actually end up spending more time making a plan with the clients in the session about how they would use that. If you're feeling like this, that's a call to a crisis service. If you want, to chat with someone, this phone line or this online chat service is going to work. And going through the website with them, just spending that bit of extra time to get that buy-in into it and make it a really solid part of the plan, so that they would end up using those services, as opposed to the, sometimes it would just be, in the past, a very cursory, like, okay, make sure you call Lifeline if you're feeling in distress, and then they'd never need to, so definitely lean more heavily on those. Would use, refer to websites a lot for psychoed components, get people to read stuff on Reach Out. I used a lot of the eating disorders websites for info on there. Just anything that they could, read between sessions, just to save the sessions for the really, really important stuff, and rely on the digital tools where they were useful.
I'm thinking they're also like CCI, the Centre for Clinical Operations, those kind of tools, workbooks.
And interestingly too, that was one, I guess, side effect of the burnout, or symptom of the burnout, that I really noticed, was my own just brain fog. I found it really hard to think, when you've got so many things running, I've got to, reply to that email and see if I can fit in that client, and then I've got to, make sure I think of a plan for them. Just the brain fog made me really scattered. And normally I'd be able to, come up with a good session plan for each client and innovate a little bit and go, okay, I think we did that skill last time, so we'll do this one this time. And I found that ability of mine really reduced through the pandemic, through that burnout. And so I found I was leaning professionally also on some of those online treatments actually to help me session plan. I'd go to say Mental Health Online, because a few of them have practitioner access, where you can basically just go in, see the program yourself, see they've got worksheets, they've got that, and I would just go in there and go, okay, cool, that looks like a good skill, and kind of adapt their modules to your session plans to save you the trouble. And CCI, the Centre for Clinical Interventions, fabulous for that too. That saved me so much brain power.
Absolutely. And that goes back to that point of what you were saying, the practitioners, this is about the practitioner burnout as well as what's coming in the door or coming in via Zoom or the, CoView or whatever it is that we're using. So you need to power up as best you can.
Yeah. And I found those actually really helpful too, because I was doing a lot of telehealth. It was so easy to just bring them up on my screen and then screen share for, your homework activity or, going through a little diagram or whatever. And I found that using digital mental health that way really reduced my stress, because the burnout was really about the demand and the workload, and being able to utilize it in that way is just minimize the impact of that on me and help me push through, because it was a good 6 months, I would say, till it felt like things had really eased out a bit or equalized a little bit.
Yeah. Yeah. And I'm wondering, how was that received by the people you're working with? Given that for some of those, this would be new, you know?
Yeah. Quite like surprisingly well. I think interestingly, because I needed it more at that stage, I bought into it.
Sold it more.
I was highly motivated to use it. So that helped me kind of sell it, or, you know, helped my clients, you know, buy into it as well. Whereas, you know, in the past, when I thought, oh, you know, this tool might be helpful, but I haven't, you know, could take it or leave it. I'm just using it maybe just to give it a, you know, just to experiment with it. I haven't got that really strong motivation to really use it. And then that's not really flowed on to the clients. You know, they've also kind of come away with a, well, we could take it or leave it. You know? And then they come back and, oh, I didn't try that. That's okay. It's, you know, fine. Whereas I found this time, because I was far more heavily invested in, we need to use this because I'm not going to be able to see you for X number of weeks, and we need to get this done, or we really need to work out some kind of support between sessions, because there's no way I can fit in an extra appointment for you. That really made it more acceptable to them as well.
How did you find on a sort of personal practitioner level it worked in relation to sort of building and connecting with your clients? Because again, then this often comes up in each podcast we do, you know, that relationship. Did you find that it enhanced that or detracted from it?
A bit of both. You know, I think it really does come down to the individual client. But in the same way that I think face-to-face therapy also comes down to individual clients, because I've known of people who really don't like sitting face-to-face to someone and talking through things, that telephone format or online format has been what they've wanted and what they've needed. So for some clients, it was no problem at all. You know, great, awesome, I love this, cool, yeah. Or they, you know, suggest stuff that they'd found to me. Oh, have you seen this? And I'm like, cool, thanks. Yeah, great. And then others who, you know, it's really not for them. So it really depends. But I think the important thing is being able to have that conversation with the client, and being open to it working or not working, you know, not going into it going this, but, you know, better work or else, or, you know, this has to work because it's, you know, the evidence says that it works, so it should work. Just being open to the fact that it might be for some people and not for others. And that, I think, makes it a bit more palatable for some clients when you're not trying to push it one way or the other, when they know that, I guess when you go into it with a really sort of curious, let's see if this, you know. Yeah.
And I guess that speaks to that really important point that it's not for everyone, and that's okay. You know? It's just an additional tool that is really great for some people, and if it's not, that's fine. You know?
Let's find what works.
Absolutely. I can't help but kind of reflect, listening to you talking now about, you know, you're in private practice, you're also got a foot in the eMHPrac camp, so you've been in digital mental health or online mental health for a long time. So as a practitioner, for you to kind of pivot more in using this is possibly a little bit easier than it is for some people who've never come across it.
Yes.
Wondering if, you know, have you got any reflections or thoughts about, and it's hard because I'm asking you to speak for, you know, peers or colleagues, how other people have gone finding it who maybe haven't got the background that you have?
Oh, so how might other people come across these or find them?
Yeah, so maybe other psychologists in your practice, for you, maybe it was a slightly easier pivot than it is for some people who just aren't really aware of what's out there.
Yeah, definitely. I think that you know, awareness is the first step. So if people are aware of certain tools, having something like I guess the pandemic or something that, you know, really is a catalyst or a real big motivator to use the tools more.
Like one moment.
Yeah, exactly. it kind of makes you go to the, you know, pushes you to the things that you already know. So, you know, if people have just maybe, you know, in passing heard of MindSpot, or in part, you know, heard a bit about This Way Up, or heard a bit about Smiling Mind, or, you know, whatever other apps and things are out there. When there's that kind of more pressing need to rely on them, to bring them in, they'll go, oh, what was that? Yeah, I'm going to go look for it. So the more, you know, the more we can promote these things so that we're hearing them in multiple places and seeing them in multiple places, the more likely we are to go, oh, actually, I think there was a website on that. I'm going to go look for it. Yep, there it is. So yeah, I think having that awareness there is really important. And I think also just being aware of because I acknowledge that, you know, the advantage that I have, the benefit I have is, you know, being across, you know, all of the different tools out there. I'm quite familiar with, you know, probably most, if not all of what, you know, in Australia anyway, there currently. And that can help me go, oh, great, that'd be good for that. That'd be good for that. But for people who are kind of new into it, or not really across it all, just familiarizing yourself with the categories of what's out there, I think is a really helpful thing. Because it really helps you organize in your mind the landscape of digital mental health, because it's massive. It's massive.
It's
I
huge.
find it overwhelming. We work in digital mental health and we find it overwhelming. So just knowing, okay, there's digital mental, there's you know, a group of resources called digital mental health treatments, and they are your standalone treatment programs that, you know, from go to woe, you know, give you the assessment and the monitoring and the, you know, 6 sessions of CBT or 6 lessons of CBT or whatever. You know, there's your MindSpot and This Way Up, Mental Health Online. There's, you know, just a few of them in that camp that deliver a full treatment. Okay, and how can that be helpful? Then over here we have the apps, which are, you know, usually to build a single skill or work on a single task or type of support. They're over here. Okay.
So we're talking like the Smiling Minds, the Mood Mission.
Mission. PTSD coach, things like that. And then we have the information websites, which are things like Black Dog Institute and Reach Out, and they have lots of information about mental health. They have tips, they have advice. It's not a dedicated treatment program, but it's really helpful, kind of low intensity kind of things. And so just knowing what those categories are, so that when you do come across a new tool or resource, or you hear about it, you can kind of start to filter them into those categories. Oh, okay, that's an app. Okay, that might be helpful for that. Oh, that's one of those treatment programs. Cool, that might be helpful for that. Okay, that's an online peer support. That'll be helpful for that. So that you can just start to, you know, categorize things in your mind, and then, you know, over time you almost build a little library in your mind of different tools. And when you've got a client, it's like, I feel so lonely. I just, you know, chatting online in these Facebook groups all the time, and I, you know, don't have it, and, you know, they're a bit toxic. And you go, okay, well, maybe an online, you know, a good moderated peer support forum for, you know, your area, you know, your, you know, issue would be really helpful. Here it is. I've, you know, got that catalogued away.
It's like a triage process.
Yeah. So I think that's a kind of a helpful way in for people who are, you know, new to the area, or, you know, not as able to kind of readily, you know, come up with these options in their practice.
And I guess that segues quite nicely into sort of talking about some of the more specific resources that are available, maybe under those categories, but also for specific practitioners, because we know there's some for the broader health practitioners, but also those in relation to, say, the doctors, the first responders, et cetera. So I don't know, a good starting point maybe there is, you know, for somebody who's thinking of using this.
Well, yeah, because we, I mean, there's, you know, a lot out there, like I was saying, that can help support your work with your clients, which can kind of indirectly help with stress and burnout. But equally, and I kind of wish, obviously these have only been created in response to the problems with burnout and the health workforce, but now there's some really great stuff there, specifically for doctors and nurses and allied health, and us who need the support ourselves. So digital mental health isn't just there to help us in our work, it's actually there to help us specifically now too. Which is fabulous. So the main one that comes to mind is from Black Dog Institute, called the Essential Network. They have a website, and it's a few different things. It's a support line, so there's a dedicated phone line for brief counselling and I think mainly referral to suitable mental health services. They also have up to 5, correct me if I'm wrong, but I'm pretty sure it's 5 sessions with the clinical psych for health practitioners, either I think face-to-face at their clinic in Sydney, but also via telehealth. And they're not linked to Medicare. And I think that's a really big concern for a lot of health practitioners, is confidentiality. Is this going to be, linked to Medicare, and AHPRA able to, access that? I want that to be kind of separate. So the Essential Network, their clinical psychology sessions are completely separate from that, and they're free. So that's amazing. So I think the phone line can kind of give you brief counselling and advice and tips, but also referral to that service if needed. And they also have an online kind of modules or online program called Navigating Burnout, which is exactly what it's for. It's fantastic, really good, and really speaks to the unique challenges that we face as health practitioners.
And I think in line with that, I think those resources or those online modules people can access again anonymously, can't they? For fear
you don't
of
even need an email address, anything. You can just go straight to them.
And I think a lot of this, I don't know about you might know, I'm not too sure about the psychologist, but the other, there's a lot of information on there that are available 24/7, so given that if someone's up at 2:00 in the morning, it's a place to go. You can go online and just go through those modules at your own pace. They're really great. And another service that I know has popped up is called Hand in Hand, and that is a remote or online peer support network for health professionals. So they offer one-on-one or group peer support. So you kind of register, I think they give you a phone call within a few days, and then they allocate you either to a one-on-one peer support person or a group peer support, which I think they meet fortnightly or something like that online for health professionals. So that's across the board.
That's across the board, health. So it's doctors, nurses, allied health, which is fabulous, because there are also some specific services for doctors. I think there's one called Doctors for Doctors, that's specifically for medical doctors and students. Mental health support and peer support. And I think there's also a nurses and midwives one. They've got a support line. There's a few others out there too. There's an online program called Peak Fortum, which is online, like sort of online program and tools and modules for first responders. So that's it too. There's quite a few really good ones popping up. We've actually compiled them all onto a fact sheet on the eMHPrac website. That's in the resource library. And if you go to the target audience, you can find there's a fact sheet there for health professionals and first responders, and it compiles all the current digital tools in Australia that we're aware of that are specifically for health practitioners.
And I think we'll put the link to that along underneath the this podcast. I'm not too sure about this. You may or may not know the answer, but the Peak Fortum, which is for the first responders, I think that's actually for their families as well, isn't it? So that's a useful one to know.
Yes, I think you're right. I haven't taken a deep dive into it, but I think you're right that it is for families and kind of loved ones as well.
Given that obviously all of us functioning in our own little world of our families, and knowing how to support somebody that you believe is starting to experience burnout is obviously really important within this.
Absolutely. Yeah.
So I guess, we've talked through some of the key programs that are available. Are there any other sort of key points that it would be useful to talk through or to let people know about?
Well, I guess that, it's also okay to use, just the general digital mental health resources out there for ourselves. And, funnily enough, it can double up as a bit of PD that serves two purposes. If you're if you're relatively new to digital mental health, or you're wanting to learn about with some of the new tools and programs and things available, going through them can also help remind you of some of those important steps to self-care. So you're learning a bit that might you're learning a bit for your tools that can help your clients, but you're also then absorbing the material yourself. I definitely can attest to that, just going through some of those tools and apps to try them out myself, because I find that's the best way to get to know them is having a use of them myself. They make suggestions and remind you of things that really help with our own self-care and well-being. I think that's one of the ironic things in our profession is that because we're practicing it, everyone thinks that we should all be mental health gurus, that we're completely happy and
got it nailed.
Got it nailed, exactly. And often we forget about the simple stuff because we're just so busy, and we let it slide. I can definitely attest to my own self-care, taking a back seat when I was in that really stressed, burnt out period, and just being reminded that, I need to schedule in time for exercise and schedule in time for some meditation. Duh, of course I do. But just going through those tools and being reminded of that really helped. It's the simple stuff that makes that the biggest difference.
Absolutely.
So have an explore, look through the tools, and sometimes I will just visit the websites as just a regular check-in, like Black Dog and Beyond Blue and things like that, because they have new stuff coming up all the time, and it's really nice to read and just have a little refresher and see what's out there.
And I guess I'd add to that as well, sort of following, getting the Black Dog newsletter, or with our eMHPrac newsletter, where we will highlight new services that are coming out, or
Absolutely.
Black Dog are highlighting new programs that are under research, just so that you develop this knowledge without really having to try. Do whatever you can to kind of passively absorb it. Newsletters are a great way to do that. There's, I think, quite a few of the services, the digital mental health treatment programs, the apps have their own newsletters, and places like organizations like Beyond Blue that develop a lot of tools. They'll all have newsletters, so they can send you these things, and even following them on places like Instagram helps you just kind of passively absorb what they're up to, and it makes it less effort on our part, when we're so time poor. The less effort the better to keep abreast of what's out there. I feel like I ought to add something around intentionality there, and not mindlessly scrolling through Instagram, which is a bit of a coping mechanism for many people.
At least fill it with the stuff you value.
Absolutely. So I guess that's, actually one other thing that I probably would mention there as well, because Origin, also in the youth mental health space, I think they often do a lot of work around online programs, again, in the sort of advent of COVID and the pandemic. So that's also one to keep an eye out as are many others, though, but going to the ones that we know are evidence-based, reputable, and just really drawing on it from there. Because I still think it's the point you made before, there's still a real overwhelm about the amount of resources that are out there. So like you said, maybe just pick one. Use it for your own mental health, as you rightly pointed out. And what we say all the time in the training and the workshops that we do is, Tanya, pick one, have a look at it, and then just build on your knowledge that way.
Absolutely. Yeah, that's great advice.
I guess we're getting to the end. Before we do, I guess this is probably highly relevant to the topic we're talking around burnout and tired, is that I am going to take a step back from hosting our Digital Mental Health Musings podcast for the very reason that my clinical practice is, I'm just going to focus on that for a while and leave the podcast in Tanya's very capable hands. So I'd also like to introduce people who are watching or listening to this to your new host, Dr. Tania McMahon. Yay!
Thanks, Ruth.
Welcome, Tanya.
Yeah, we're sorry to be losing a very capable hands and interviewing skills for this podcast, and I know I've got big shoes to fill here. But I'm really, really excited to be taking over, and I've got some really exciting ideas about interviews that we'd like to have and places we'd like to profile, and really getting the message about digital mental health out there and how it can really help make our jobs easier.
Absolutely. I have no doubt that it's in very capable hands. I really can't wait to see where you take it, Tanya. I'm sure there'll be some great stuff coming out in the coming year. So thank you for taking it over.
My pleasure. Looking forward to it. So
I guess that's a sign off from both of us. It's a goodbye from me. And for people who are watching it, I very much hope you've enjoyed the ones that I've been involved with. And equally, I hope you continue to really enjoy what Tanya's going to bring in the future. So keep an eye on the new episodes coming out. And we may cross paths again soon. Thanks again, Tanya, for joining us today.
Pleasure.